Hello, my name is Chris Barbary and I'm one of the chaplains at Floyd Medical Center. In this series of short videos, I will be explaining the Georgia Advance Directive, which has 4 parts. In this segment, I will explain Part 2. Part 2 is called Treatment Preferences. This part has 4 sections. This part of the Advance Directive used to be known as a living will. The first section of this part is called Conditions. This section specifies the conditions under which the rest of the treatment preferences apply. There are 2 possible conditions, and someone completing Part 2 must select one or both conditions. The first condition is if a person experiences a terminal condition that is incurable and irreversible. Essentially, the doctors have said that no more treatment options are available and that death is expected in a short period of time. Usually, when a disease has reached this point, the doctors can no longer look to the patient for any medical decisions. The second condition is if a patient experiences a severe brain injury, resulting in what the doctors feel is a permanent state of unconsciousness. Patients in this condition are not aware of themselves or their surroundings, and the doctors are unable to communicate with them. In completing this section, a person initials by one or both of these conditions. Note that the entire Part 2 is invalid if at least one of these conditions has not been initialed. The next section is called Treatment Preferences. In this section, you specify what treatments you want or do not want in the case of permanent unconsciousness or the end of a terminal condition. There are 3 choices: A, B, or C. Option A says the patient wants all aggressive treatments for his or her condition. This means the patient wants CPR if his or her heart stops. It means he or she wants to go on a ventilator or life support if the lungs fail. If the patient can no longer feed himself or herself, the patient wants a feeding tube surgically implanted in their belly and IV fluids to be provided. Sometimes we call this the every machine and every medicine approach. The goal of option A is to keep the person's body alive as long as possible, even if quality of life will likely suffer while receiving these treatments. Option B is a different approach. The goal of option B is comfort. It says the person does not want any aggressive treatments. The patient wants the medical team to allow a natural death to occur and does not want CPR, life support, a feeding tube, or IV fluids. Medicines will be provided for any symptoms causing discomfort, such as pain, nausea, anxiety, insomnia, etc. The patient will be kept as comfortable as possible for as long as possible. Sometimes patients choosing option B would like to go home rather than be in the hospital. This is sometimes possible by utilizing the benefit of hospice. Option C is a middle ground between options A and B. It allows a person to specify that they want some of the aggressive treatments, but not all of them. One patient might say he wants the ventilator, but not CPR. Another might say she wants CPR, but not a feeding tube. Option C lets a person pick and choose between the aggressive treatments. To complete this section, initial next to the option you choose. If you choose option C, you must also initial by the specific aggressive treatments you want to receive. At least one of them, but not all 4 of them. The next section is optional and called Additional Statements. This is the place for you to document any special instructions you may have. The Advance Directive form gives several medical examples of possible special instructions. You are not limited to these examples. Sometimes people like to put a time limit on receiving aggressive treatments. For example, if my overall medical condition is not improving in 48 hours, allow my natural death to occur. Others may make a quality of life statement. If I cannot walk or feed myself or am unlikely to regain these functions, stop aggressive treatments. If you decide to write in special instructions, please be sure they are clearly stated and easily understood. They will provide guidance for your healthcare agent and medical team. Avoid terms and phrases that are ambiguous or could be misinterpreted. If you would like assistance, our chaplains are available to help you think through and formalize your thoughts. The last section of Part 2 is optional and is called In Case of Pregnancy. It states that Part 2 will not be in effect if the patient is pregnant. The only exception to this is if the fetus has been determined to not be viable. If the fetus is not viable, the person has the option of initialing, saying they do not want Part 2 to be in effect. In summary, Part 2 of the Advance Directive is called Treatment Preferences, and it lets you specify whether you do or do not want aggressive treatments like CPR and life support in either of the serious conditions described. One question that comes up frequently is whether these choices are set in stone. The answer is no. They are called treatment preferences intentionally. They provide guidance about your wishes to your family and your medical team. Ultimately, the healthcare agent named in Part 1 is empowered to make the final decision. Documenting your wishes and treatment preferences can provide you and your family with peace of mind and also prevent family conflict. In the next segment, we'll look at Part 3, Guardianship.